If you're from the south side of Chicago, like my dad, you say Sarabia. And then there's different variations. I go by Sarabia. I don't have folks roll the R's because sometimes it's, it's easier just to say Sarabia. But with that, I wanted to at least like get myself calm and warm up the room a little bit with some authentic pieces. And we have we have 9 panelists, I believe, in the room today. And so as we have these general questions, I'm going to ask folks to please help us remember, where your role is and what your position is, and then how you contribute to this body of work. And the general questions, I'm going to ask everybody, and we'll kind of go around, and let's try to be conscious of our time because we want to get into it, but like also make sure we hear from all the voices in the room. So the first question, that's a general question, and I'm going to pop it out. And then if folks want to chime in, we can, I don't know if we're going to use hand function, but you can signal to me and then just kind of dive in and introduce yourself first, please, and just talk more about your background. So the general question is, what first brought you to this work? What inspired you to become an advocate or leader in this space? And how did you even come into working in this arena? I'm gonna fold that into, in this work, what have you also seen as challenges or barriers, and then opportunities? Again, in the context of working with racially and ethnically diverse folks, many of us whom we are or are part of our families, but then also the construct of immigrants and refugees and what's working and not working, particularly in this pandemic in a COVID environment.
There we go. Good morning. I'm Kelly Robinson. I am CEO of Messianic Care and a member of Black Nurses Rock Twin Cities chapter. Your question was, how did I come to do this work? So I've been a nurse for 28 years now, been in the Minneapolis area for 13 years. Let's make this short. COVID hit. We didn't know what to do, but we wanted to be impactful. And one of the things I did was a general research to see how we were implementing the testing. The first thing I saw over the north side was the administration of testing, but not by people of color. And so because of the hesitancy, the lack of awareness and understanding of a pandemic and what was going on and what was really happening to all of us, it was important for Black Nurses Rock to be that trusted messenger, to have those conversations, to bring about understanding. So that's it in a nutshell.
Thank you so much.
You're welcome.
I see Mark up next to respond to that general question.
Yeah, be happy to go next. My name is Mark. I lead the vaccination team, previously the testing team for Ramsey County Public Health, St. Paul Ramsey County Public Health. I got into this work over a decade ago after the earthquake in Haiti, and have since been working mostly overseas with kind of the poorest of the poor in different disaster zones, from Haiti to Afghanistan, the Philippines, India, Nepal, those types of places. It's always been kind of a no-brainer to me. I was actually born in Kenya when my father was a Peace Corps director. So it's just kind of a family, I didn't really have a choice into it. It was just a no-brainer to work in this field. And health equity is probably the most important thing that I can see. If you don't have health, you don't have much. And, even in this country with all our resources, we have a lot of people falling through the cracks, a lot of inequity. And I think it's probably one of the most important, if not the most important field to work in, particularly right now when we've lost over 1 million Americans already, 13,000 in this state alone and 1,300 in Ramsey County.
Thank you, Mark. I see, I'm going to say Oswaldo. Okay, Oswaldo has his hand up next. And again, just exploring folks to introduce themselves and how they've got connected to this work and why it's important, barriers and opportunities. Thanks, Oswaldo.
Thank you. Hi, my name is Oswaldo Cabrera. I'm an officer in charge to the Community Affairs and Health Promotion in the Consulate of Mexico in St. Paul. And so I was working in the field of consular services for 15 years. And I start to work in Nogales, Arizona, in the border, helping to communities, Mexican community crossing the border, and in operations with other organizations for help to people in disaster coming into United States. And I was working face to face with the Mexican community in the consular services for all this last 15 years. And I was involved in the promotion of health when the pandemic coming to impact to us. And obviously for the Mexican population, it was a big challenge. So it was a great challenge and inspirations for work together with a lot of organizations and volunteers and community members and Mexican leaders and the whole circumscriptions that we cover for bringing the services, the community in my case, in the whole state of Minnesota, North Dakota, South Dakota, and 19 counties in Wisconsin. So we cover all those circumscription. And for this 2 years, I was working in the field, helping to the Mexican community for opening the health services for all those Mexican community living in all our circumscription. Thank you very much.
Thank you, Oswaldo. I see Soe Khu would like to chime in.
Yes. Hi, I'm Soe Khu with Ramsey County Public Health. I work as Led and Healthy Home programs. I work in a Led and Healthy Homes program. And since COVID started, I knew I was going to pull into ICS because Instant Command, as a public health worker, they get us in. And I knew I will have to work in there because I spoke Korean, and there's a lot of Korean families, refugees that need help. And especially if they're new to the country, they don't know where to get resource. And I'm glad that I was able to get in touch with the people and able to help them. Yeah, so I had I'm glad that I also wanted to be in part of ICS, just knowing that there's a lot of Korean families here who are in need of help, translation. So that's how I got involved with, and I feel really happy to be involved with.
Thank you.
Mm-hmm.
I see Abdiqafar.
Good morning, Tim. Yeah. Thanks for the Center for Justice Law at the Hamline University, and I'm very delighted to be part of this great panel discussion about this great topic. My name is Abdiqafar Jama. I'm a Somali and a abroad immigrant in the United States. I work at the Ayana Islamic Association of North America. Ayana, I'm a program manager at the COVID-19 community coordinator. So Ayana is part of the state's efforts in responding COVID-19 because since the start of the pandemic, the state has contracted community-based organizations that connect Minnesota's diverse communities to plan, host, and support vaccine events, testing sites, and connect communities to the other resources. In particular, Ayana has been working across the Islamic centers in Minnesota. We have been supporting testing sites across the state. We have been planning, hosting, and supporting vaccine events in the mosques. We were also sending Somali doctors and other staff to distribute PPE, masks, hand sanitizers, and other COVID-related resources into those mosques. What really inspired me to be part of this effort was when the pandemic started. I was in Somalia. At that time, I was working with the Somali government, especially the Ministry of Planning, Investment, and Economic Development. I just came back on July 2020. And when I came back, the pandemic started. And yeah, I was reached by the the director of the Islamic Association of North America, and he explained to me everything. And I said, maybe it's really good time to work your community, as I'm an immigrant to the United States, and I came to this country in 2013. And that's time when we started to be part on advocating to the immigrants, in particular, the East African immigrants in Minnesota. I can proudly say, since when we started this program on October 2020, yeah, we supported over 50 community testing sites. We were sending a lot of COVID-19 support staff who are Somali speaking support staff who are helping to the elders at the testing sites. I can proudly say we hosted over 50 vaccination events, and thanks for the support from the mHealth vaccine provider, and also Minnesota Department of Health and Hennepin County in supporting those vaccine events. So we can proudly say we vaccinated over 3,000 Minnesotans, mainly immigrants. Yeah.
Thank you, Abdiqafar. We will definitely dive into more of that. I'm hearing these themes coming up as you guys are introducing yourselves and talking through this. So I think we're going to have some more pointed questions and get into the richness. And I'm so thankful that this is a cross-sector group of people on the ground, government folks, community-based folks. This is the direction we need to go to have system solutions to make sure we all get better health outcomes, regardless of where folks are from, and centering our humanity, I think is really important, while acknowledging that cultural richness. So I saw Ingrid. Ingrid, I'm going to go ahead and pass the mic to you. Thank you so much.
Yeah, thank you. I'm Ingrid Johansen, and I am the director of the MINI program out of mHealth Fairview. So MINI stands for Minnesota Immunization Networking Initiative. And for the introduction, I can say that what led me to this work, my background was actually in public health before becoming a nurse, and my focus had been on the intersection of poverty and disparity and infectious disease burden. So that's always been a strong focus for me and passion for me. You know, prevention really has to address the social determinants of health, or your true lasting change won't be possible. And that's always led my focus in public health. But I learned early on in my career that I was missing kind of a closer connection to people, and so pursued a nursing degree. Went into nursing school to have that bridge for the caring science and the clinical science and public health. And I actually volunteered for the MINI program 12 years ago, and just as a volunteer vaccinator, answered a call for an email, and showed up at a faith community that an Ethiopian Orthodox faith community providing vaccinations, and was just blown away by the very collaborative and respectful and partnership driven program, and have really never left, and then became the director a few years ago. But it just really makes sense for communities and other trusted organizations to partner with faith organizations and health systems to provide these services. And so it's been my privilege to be a part of this program. And I have to say too, we've been thinking about the what if of a pandemic, and the what if there's a vaccine for that pandemic, for years, and talking with our partners, and surveying and planning and discussing and recognizing that we had a platform that would be incredibly important for connecting with diverse communities, as the MINI program always has, to make sure that there was equitable access to a vaccine in light of a pandemic. So this was something we had been working towards, and have been so privileged to work with many of the incredible people on this panel to make that happen, by partnering, you know, with what we have as a healthcare organization, and as nurses, and as training, and then working really collaboratively with amazing community partners to make this a reality.
Thank you. Thanks, Ingrid. I think there's a couple more folks who could introduce themselves, and thank you. Commissioner Matas Castillo.
Thank you, Maria. It's so great to be here with you all. I'm Trista Matas Castillo. I'm a Ramsey County Commissioner and currently the chair of the Ramsey County Board. But you know, I think all this work for many of us as we're hearing our stories is personal. So my husband is an immigrant and his entire family are immigrants from Guatemala. And so for me, it was really personal. I spent most of my career in the military doing first response, doing incident command work with community, and saw firsthand how so much of our immigrant community doesn't trust government, and for really good reason. And knowing that when COVID hit, this was going to have to be a government coordinated response, that we had to make sure that we did it in a way that could build trust and collaboration across all of our communities, because it is, you know, without health, we all fail. And I represent the most racially and ethnically diverse community in the state of Minnesota. And so I'm not just talking about my family, but I'm talking about all my neighbors and my friends. And so we needed to do this work different, and it was about trust building. So that was the barrier and the success, I think.
Thank you. And I see Mary.
Hi, my name is Mary Langworthy. I'm the Director of Health and Wellness for St. Paul Public Schools. I am a registered nurse as well, and I think I've always worked in situations or in communities or positions where we have very disadvantaged populations or high-risk populations. And so when the pandemic came, I think the opportunity to work within the school setting to support not only our students, but our families and our community, and really work hard to partner with people in our community to help provide accurate information, resources, support at a time when people were really afraid. And we kind of had people at different places, people that were angry and upset and fearful, to people that were maybe ignoring or weren't aware of the complications of COVID. So it's been really interesting ride to try and support people in a variety of different places and spaces and keep them informed and feel like they can trust us and hear from us, and that we'll be there for them. So it's been an interesting ride over the past couple of years.
Thank you. Thanks so much. I think we've heard from everybody, got a chance to introduce themselves, speak to their connection to the work. And it's just a powerhouse. This is a panel of powerhouse folks from across our communities, and it's important work, and I know it's hard work too. And I agree with in my mind, I'm very visual, so I picture like a word cloud, and trust is the biggest word. And I also come from more of like an oral tradition where we want to really dive in and talk and have a sip of coffee. I'm trying to stick to this 90-minute mark, but there's so many other words and feelings that came up around trust. I heard the word hesitancy. I heard equity and health as like a human need, and if not having health, you have nothing. I heard the need for these technical systems and structures, whether it's government or public health systems, needing to be connected and woven into fabrics of our cultures and our communities. So with that, I'm going to keep going. I'm going to poke us down into some of the more pointed questions here. And the first question is going to go to Trista Matas Castillo, and really looking at the strategy piece. And so we knew we needed to do things different. We knew we've never been in this space before in history, but what strategies are working and for us to be able to connect and convene such rich diversity together to work towards addressing the challenges that come with COVID?
Yeah, thank you for that question. You know, I think in some cases, even though we had never responded to this kind of pandemic at a local level in history, Ramsey County was ahead of the game even before the pandemic came. And that is because we have centered racial and health equity as a key strategic priority for a long time. And that wasn't new for us. And so since we already had been working in that direction and to address changing the systems that you know, reinforce white supremacy at Ramsey County and that we've been deconstructing, when this pandemic hit, we had an opportunity to then just lay out not just our priorities, but really to say, now we have something to tackle, and we're going to use the skills and the vision that we've put in place to make it happen. So it was an opportunity for our community to hold us accountable. It was an opportunity for ourselves to be held accountable, and our staff. We have an incredible staff who have led us in this direction, and as policymakers, we know this is not just the right thing to do, but it's a must. It's a moral imperative. And so the pandemic hit, and and in some cases early on when the lockdown hit, everybody was locked down. And so we had some opportunity to say, as these things happen, or as people start coming out, because it was frontline workers, often from our immigrant and refugee community, that continued to go to work when other people had the opportunity to stay home. And so we could focus in and say, what is it that you need? How do we take care of you? Is it food support? Is it transportation? Is it access to digital, a connection to do all the things everyone else is doing? And so really it gave us the opportunity to kind of work at it strategically. I think the best part, and it goes to this trust, this is the most important piece for me, is that we heard from our immigrant and refugee community their concerns, why they didn't trust the information they were getting, or that they weren't getting it at all because we didn't have it in the right language, we didn't have the right people talking, or there's just been a historic abuse on medical, in particular vaccines across the world, or governments forcing people to take things that they may or may not have agreed with on their own. And to really say, we're not going to do that. We're going to do it by going to the community where people trust those messengers. And I see so many of them on the screen with us today. So thank you all for being our trusted messengers. But we were able to create a trusted messenger program where we gave our resources as a county directly to community, like Black Nurses Rock, right? Who have done vaccine clinics and testing clinics, the Hmong Council of 18, Dawa Institute, Project Restore. We went to the community and said, we will resource you, help us get to the people who need it in the way that they can accept it, and really going beyond. And so many on this call are from our team who've led that work. And so as a policymaker, it was in a lot of ways easy because we had the right people in place following our vision and values around racial and health equity, and we were able to implement and go and target and track and keep data and keep checking ourselves to make sure, like, if there are communities that there's low vaccination rates or they need more support, we targeted our resources and really focused in. And so it was a really incredible opportunity to be strategic, to be thoughtful, and to be inclusive for our whole community.
Thank you. Thank you so much. I hear, this is my thing, the power of pause. When we were all on lockdown, we put that time to good use and leveraged all the work that had been in progress. I love the idea of it having been a concept, and now we actually applied the strategies to get to the ground level to work with communities. So much richness. Okay, so Oswaldo, you're up next. I'm going to ask you the question, what role, and this is again going back to trust, and we can even dig what's underneath trust, like, because I hear us talking about we had opportunities, money came, everything shut down. What do we need to do to sustain it now? So trust comes in engaging with our communities as it relates to the Latino, Latinx, in this, I think because of the consulate, purely people of Mexican descent, or the intersectionality of Central South Caribbean, for this groups of Latinos and folks in Latinx community, immigrants, what is that factor of trust in terms of engaging specifically with the population that you're working with?
Thank you for the question and for the opportunity for share. What important is the trust for us. Obviously, this is the Consulate of Mexico is the house of all Mexicans living in our circumscriptions. Every day we attend more than 100 persons coming into the consulate for receive services. And we, since more than 12 years ago, we start this program for Ventanilla de Salud program, the health window program, in order to offering health services for the community in vulnerable situation. As you know, a lot of our community, they doesn't have access to health programs because they don't have the the program for offering access to the main health services. So we start this collaboration with St. Mary's Health Clinics, and every day we have this community health worker working here in the consulate offering health orientation and information for all the Mexican community coming from all our circumscriptions. And when the pandemic coming, it was very, very important to offering the trust our community, because as you know, they was so afraid about share the information about share if they was detected with positive cases, COVID positive virus, and we start the communication with our community, and then we start the collaboration and all the power of the diplomacy for start this collaboration with Ramsey County, Health Fairview, a lot of organizations and volunteers for offering services in the pandemic. Like first of all, with the testings, as you know, for our community, the barrier of the language offering services in Spanish, it's very, very important. And we decide to open the door to the consulate for offering first COVID testings and then the vaccination clinics. And just as an example, last year we offered more than 10,000 doses of vaccines in the consular action. So, and thanks for the Ramsey County collaboration, Ingrid at the Health Fairview team, and all the community leaders and people that help us to spread the voice about this consular service. And now I'm so happy, glad to say that not just Mexican, all Latino community feel very, very comfortable to coming at the consulate for receive the vaccination service and other health services, because now we discover with the pandemic that it's very, very important to offer other health services. Now the mental health is another issue that we discover in our community, and we are working a lot to offering these resources for attend this other emergency, the mental health emergency. And so now we are navigating into the pandemic, discovering all those other issues, and for sure we are going to work with our partners using all the power of the diplomacy for bringing more services at the consulate. And at the same time, I would like to say thank you very much for all the partners that help us to offering these services. Just an example, for one vaccination clinic in the consulate, we need around 20 volunteers working. And so this is the extraordinary effort for support our community, and on the name to the Mexican community living in Minnesota and our circumscription. Thank you very much.
Thank you, Oswaldo. I hear access and I hear language is a huge piece for the Caribbean, for the Spanish speaking community. I think that's across the global diaspora in terms of working with folks who come from different places, making sure that we're able to provide services in language and then sustain it. I agree, Oswaldo, también, like the piece around assessing the damage and mental health is a huge thing. You know, we were dealing with the crisis, but now we also have to deal with the aftermath. So forgive me, they're gonna never ask me to come back in because I'm being way too conversational. I'm gonna ask Mark Jackson for the next question. You have more of a global World Health Organization background. So how have your experiences in the global context, working with WHO, informed your work here at the county level and with COVID?
Thanks. Yeah, kind of vastly different way of doing things. Far more bureaucracy here. You know, we have phase 1, phase 1A, phase 1B, all that stuff. You know, it just wouldn't exist in some of the countries that I've had the pleasure of working in. Previously, the most recent vaccination campaign that I worked on was in East Timor 6 or 7 years ago, and we vaccinated 500,000 kids in 3 weeks. And it's basically just any kid under 14 years old walking around, they're getting a dose of polio vaccine and measles, rubella. Like, there's just no other guidelines. You go into the schools, out to every single village in the whole country, and people just agree to it. You know, there's no hesitancy. There's no militant press demonizing the vaccine, or that the vaccine is microchipped, or any of these other insane rumors that we've heard. So that was a huge change. There's a lot of similarities, though, too, particularly working with the Karen community. This reminded me a lot of working in Southeast Asia, with things like, you know, appointment times aren't quite as important. And that's not a criticism at all. It's just the way it is. So we've tried to adapt some of our clinics to that. You know, we don't use, for most of our clinics, like the ones with St. Paul Public Schools, with Mary and her team, you know, we have a link that goes out and people make their registrations online. We know that that's a tech barrier for some of these communities. So we don't use that. We have translated forms that are in Karen, or in Somali, or in Oromo, in Hmong. And, you know, people can just show up whenever it's convenient for them, whenever they get off work, or whenever they're done with childcare, and they can come in and quickly sign up and get it done. We really try to, as much as we can, pair the focus community for whichever vaccine clinic we're doing that day. And we try to match the vaccinators to have at least some familiar faces, people who look and talk like the group that we're serving. That's been a little bit difficult, you know, and I think Soe Khu would agree. We don't really have any nurses that speak Karen. We have one, she's actually Burmese, and learned Karen when she was in Myanmar. But other than that, you know, more of a new recent group that's arrived. They're not quite as well established as, say, the Hmong community, who does have the Hmong Healthcare Coalition and partnerships like that. So that's been a challenge. Absolutely. But, you know, we've tried to mitigate that by running those clinics in trusted locations. First Baptist Church, actually, we're doing a clinic this afternoon, this evening with them. And I'm trying to arrange a few things right now, but getting those folks who can come translate, help out with that, make people feel comfortable. You know, that's a key part. And, you know, that it just reminds me of some of that other work that I've done overseas. So, you know, some of those resource limitations that we've seen also are kind of similar. I could go on for a while about it, but I don't want to waste time.
Thank you. That's excellent, Mark. I love the call out for the loose relationship with time and appointments for our communities. That resonates for me and my family for sure.
Yeah, best not to fight it, just accept it and move forward, and try to really have it be a collaborative effort, not something that is, you know, no pressure. We want to make sure those sites aren't intimidating at all. And having, you know, even at the Consulate of Mexico, we deliberately did not want to have any security or any off-duty police there to keep order. We had a lot of, you know, concerns about that when it comes to immigration and paperwork and things like that. And Oswaldo and his team have obviously been extremely important in that effort.
Very good. Thank you. Definitely some good lessons learned. You're up next, and I'm going to throw the question in the chat. So it's around health equity and how health or racial equity shows up as a determinant with the work that you're doing in a COVID response. Can you speak to that a little bit for us? And
yes.
Okay, thanks.
Sorry, it took me a second to find my mute. So health equity, yeah, I would say kind of just giving some context again about the program, because health equity was the driving force for the development of MINI 16 years ago from the very beginning. And it was established out of a call actually from the CDC, who reached out to health systems that had relationships with faith communities to ask for ideas and action around how to work together to address the very persistent and concerning disparity in seasonal influenza vaccination for communities of color. and the recognition that communities of color were also facing a more significant and severe outcomes if infected with influenza, longer hospitalization stays, and then a real concern around, barriers and this persistent disparity. So our founding partners include organizations that are still at the table today. And it began as a really small operation with some volunteer nurses and donated vaccine, and really passionate, willing partners that opened doors and hosted clinics, and has grown today to, from on an average flu season before COVID vaccination hit, around 120 clinics during a flu season. And around 80 to 90% of the community members that choose to get a vaccine with us at those sites identify as a member of a BIPOC community. And over half share that English is not their preferred language. So you can see that it's a strategy that works. And I think too, it's a testament to just this model of listening to community about what are the barriers that people are experiencing and attempting to dismantle them. We survey our community partners, and people share that, access is huge and complex and not the same. The challenges with access aren't the same for every community and every individual, but it includes things like transportation. The challenge with appointments, that's something that's really complicated for a lot of community members to have the time to get an appointment or to understand the system to navigate it, or there are tech barriers to that, language barriers. Lack of insurance is a huge barrier. And convenience as well. We try to make our program very convenient in attempts to, again, just make these services more equitable. People work late hours or double jobs and have childcare issues, and your typical brick and mortar clinic hours are not very accessible for many people. So we work with our partners to make sure that we're there in the evening, and we're there on the weekends, and we're there pretty much 7 days a week around the community, providing the service at times that families find more convenient. We've also heard from community members that, it's really challenging when you have, kids and grandma and you, and when can you find times to get everybody in for a service? So we've always served the entire family at our events, and just really rolled that model through when addressing COVID, and really ramped it up from 100 some clinics per year to over 500 in the last year to make sure that.
Thank you so much.
Mhm.
I don't want to cut you off, but thank you.
Yep.
Okay, Ingrid, that's a very important work. Thank you so much. I'm gonna let Kelly know. Kelly has the next question. Kelly Robinson with Black Nurses Rock. And I'm gonna go through the question. So with Black Nurses Rock, it's an organization that's centered on identities here in the Twin Cities and Minnesota during a racial reckoning that's occurred over the past couple of years. What does it mean to you to be part of an organization that works to inspire and empower and educate vulnerable communities? And there's a two-part to that. Historically, communities were regularly referred to as vulnerable. And so I'd like to know also, how do you respond or engage or feel about that framing? Ms. Kelly, I'll hand it over.
That's a loaded question.
I didn't write it. But be authentic. Let's dig deep.
Yeah, so as a nurse, we feel a calling, in all of what we do. And then in this day and time, with what we're dealing with racially, just across the board, there's a greater impact, because historically, the people that have been trusted in our community are the professionals. It's like when it comes to a nurse, you know, everybody, we're like the nurse for the family across the board, regardless of, you know, our ethnicity, but even more so in the Black community. And I want to say it, you know, and when we talk Black, I'm talking people of color, you know, whether they are African or otherwise. It's been exciting, which sounds weird, but it's been exciting to be that voice, to be that trusted person in the underserved area. There's so much that they needed. And sometimes it wasn't even nursing, you know, it was other things, just that aspect of having someone you can talk to and trust, because everyone was vulnerable, you know, and it didn't matter what their socioeconomic status was, because no one could go anywhere. So during this time frame, for us as Black nurses, it's like our season, or should I say it is? No, we're tired now, but you know, we're still pushing because the need continues to get greater and greater. And how do I feel about that word, being a underserved, vulnerable community? That's what they are, you know? And as soon as we take for granted that some people don't, or should I say, they do understand, it takes away from the opportunity to get in front of them and ask the questions, because we can assume that they're hesitant. We can assume that they don't understand. But until we have that conversation, do we learn, you know, what that really, really looks like for each individual. And that's how we've addressed it. You know, we've been using the MDH bus, and that has been like the haven for conversations. You know, people feel as though, wow, I'm away from my family. I can actually ask a question and get an answer and feel okay about it, you know, because immediately there's an automatic connection that we have.
Thank you. Thank you, Ms. Kelly. So we have Soe Khu Paw with the next question, and we're trying to understand more. So what is the biggest change or shift you think needs to happen to improve the work with the communities you're working with around COVID? And I'll throw that in for us too.
Yeah, thank you for the questions. I think that we are all doing our best in our own way, and we can't say we are doing a perfect job in what we're doing, but there's always change that need to be done. And the longer we work, we'll learn new things, and we're gonna need to make some change. And to improve our work, there always going to need to be change. And I think that I believe we should have maybe a permanent worker for specifically just COVID, because I don't think COVID is going anywhere. And we're going to need to learn to live with it and be safe about it. And there should be always resource for COVID for everyone, whether it's low-income refugees, different background, different languages. We should have resource for them. And how do we reach families who are isolated, doesn't speak English? How do we reach to these families and maybe work with community organization that these families go to so that they could get these informations, have contact with? That could be one of the things that could help the family to reach out everyone's in the area. Yeah, so if anyone else have any idea how we could improve the work, feel free to answer that too.
The little bubbles in my head keep saying, like, it's not individualism, it's families, it's communities, it's serving the whole. Thank you for that. So I'm going to move to a question we have for Abdiqafar. How does your identity and experience, your lived experience as an immigrant, inform your work?
Yeah,
Mhm.
thank you very much, Maria. I think that's a very broad question in terms of, the broad issue about the immigrant, but I will try to make it short. Before jumping into the question, I want to say first, it is very crucial to keep in mind that many folks in the country today came to the country initially as immigrants and were able to become part of their communities, and they obtained their citizenship and part of the US population through hard work, patience, and dedication to America's core values. And those Americans with different and unique journeys, probably in coming as an immigrant to the United States, understand the immigrant experience in their own way. So as I'm talking about my identity and experience and as an immigrant and how it forms my work, I'm explaining on my own way. So if other immigrants probably see their own way, it's quite a bit different. Actually, as an immigrant, when the pandemic started, the immigrant population across the nation was those who were hit so hard for the pandemic, and probably less participation in those efforts to tackling the pandemic. So as I explained it in the beginning, AYANA was created in 2001 to represent Islamic centers across the nation. So it has over 30 members across nationwide and over 15 members in Minnesota only. So at that time, the board came together and decided that they might need some kind of participation, as they are immigrants and can represent the community in order to understand how the easy way to tackle those the pandemic, because there was a lot of barriers in the immigrant communities. There was less accessibility in reaching to the community testing sites. They were having also a huge vaccine hesitance in the community when it was announced that the COVID-19 vaccinations are available to the US population or to the world population. There was a lot of challenges and barriers among the community. And as immigrant, first, we tried to represent our community to participate the efforts from the state in order to see those challenges and try to find solutions to those problems. Thankfully, we became part of the COVID-19 community coordinators, the community-based organizations that are contracted with the state, especially Minnesota Department of Health. In the beginning, when there was no vaccine, we were trying to create a task force who are going to the community centers, to the mosques, who are doing weekly briefing to the immigrant communities, talking to their native language, explaining what is going on in the country and in the state, connecting non-barrier community testing sites to those communities. We were regularly sending our staff and some contractual organizations to those community centers to speak the congregations and explaining, go to the community non-barrier testing sites. And that time, actually, we identified some challenges among the immigrant population. For example, some people were assuming they might need ID, they might need insurance to go those testing sites. So we told them that a non-barrier community testing sites, our staff there, the elders and the families who are less, might need some language support in completing the forms and just telling the instructions. And it was really a good journey as an immigrant. When you are representing those communities, there was a lot of challenges in terms of you're not getting enough funds to host their vaccine events in every mosque. As I said, AYANA has over 15 Islamic centers in Minnesota, and we only host a vaccine events for only 3 mosques, one in St. Paul, Minneapolis, and Bloomington. So imagine having 15 Islamic centers in Minnesota and only having hosting a vaccine event on 3 only. And that's why some of our efforts is in planning, hosting, and supporting those vaccination events were really successful. Some of our vaccination events were very close to the community. They were very accessible. Elders and seniors who are living the high rises in Minneapolis and St. Paul can come to those vaccination events. Sometimes our vaccine events attracted over 200, 300 people. I do really appreciate identifying to those trusted community locations in the immigrant community was a very successful journey. And as an immigrant, the challenges and the barriers that the immigrant community are experiencing is really complicated. Some of the challenges. Imagine a person who is not documented in this country and not able to go to a testing site or to a vaccine event to attend those. Thanks to the MDH, Hennepin County, and the other counties like Ramsey County who participated our efforts. In particular, Hennepin County and MDH facilitated one concern we faced during our journey was vaccine hesitancy. Many immigrant communities has a lot of vaccine hesitancy because the people are not accepting. We got a solution for that because we received a vaccine incentive from Minnesota Department of Health and Hennepin County, and that helped us to encourage immigrant families and communities to participate in the vaccine events, because many families are really a huge thing in getting $50 vaccine incentive when they are taking vaccine incentive. We send immediate families, we send extended families attending our vaccine events in order to get the vaccine and get that vaccine incentive. There's a lot of challenges that we were experiencing as an immigrant, but I think as we are having, just 90 minutes to cover many things, I do really appreciate for our partners like mHealth, MDH, and other partners who participated these efforts in hosting a trusted community locations, vaccine events across those cities. Back to Maria.
Thank you. Thank you. There's a lot to unpack, and I'm going to practice pause and not comment because I want to get to Mary. And then after we get to Mary, I think we might be able to have a little bit more just kind of discussion. So thank you for that, Abdiqafar. So Mary, we know that you're presenting from St. Paul Public Schools. I am a mom of St. Paul Public School students. I am married to an immigrant man as well. My kids are Black Latino kids. My husband is from the Democratic Republic of Congo. We are transplants, but we have made Minnesota our home. We know that St. Paul Public Schools are the most racially and ethnically diverse schools in the nation. And as a leader in health and well-being, we want us to know more about your unique perspectives of all that's going on with the schools and how can we serve our children and our families. What are some lessons you've learned through this process? I will do a selfish plug and say the teachers in the schools for me has been a pseudo extension of my family, especially at the beginning of this in terms of really caring for our children and making sure we had some food when everybody was sheltering in place. And so I'll leave it there. But Mary, if you could give us some of your insights from the school perspective.
Thank you, Maria. Yeah, I think I could talk all day. It's been quite complicated over the past couple of years with all that we've had to navigate. I think the starting point for St. Paul Public Schools is because we have such a diverse population. I think we're pretty grounded in that equity work, trying to make sure that we're supporting and there for all of our diverse cultures, all of our community that surrounds us and is a part of us. It's been really, really complicated in terms of communication, I think is probably the stemming point. So I think we do a good job of trying to hire and retain people of color so that when our kids come into our health offices, into our schools, that the kids see people that look like them, see people that speak like them, that understand them. And that's that starting point of trust and relationship building, which has been so critical during this time. But on top of COVID, because of COVID, we went into distance learning, which added just that extra layer of complication in how do we work with our families? How do we support them? How do we help move these kids forward educationally when there already is a huge achievement gap that exists that we're trying to support with our BIPOC communities, our minority populations? It's been an ongoing challenge that our kids, unfortunately, are further behind now than where they were before. And it's really challenging thinking about how to bring that forward. But again, that relationship, that trust is super integral to both the educational side as well as the health side. I think the other piece is people are asking and wanting us to be the everything for families. And that's really great, but it's also just a lot of pressure, I think, for our schools, that from testing to vaccines to keeping everybody safe, to making sure they have access to food, to making sure that they have access to education. There's a lot put on our schools at a time when there's a teacher shortage, there's a nursing shortage. We were not fully staffed this year on top of having COVID. So it's just a lot of added pressure on the system to meet all those demands. And that's thankfully where we've been able to partner with a lot of great organizations. Mark and I have worked really closely to provide a lot of vaccine opportunity for our staff, for our families, for our students. Testing opportunities in particular has been an ongoing battle, and thankfully has been improving more recently. But the communication with all of the changing guidelines from CDC, the Minnesota Department of Health, trying to apply that, learn it, digest it as a team within my department, which I have 120 people in my staff that have to learn and understand the new guidelines, apply it the next day, and support people to understand those new guidelines too. So just lots of pivoting that we've had to do, lots of review of content with people, help them understand this is how we need to keep you safe. This is the guidelines currently. We need to here are the resources that exist. Here's where you can go get tested. Here's where you can get the vaccine, which is super critical. It's all been really complicated, but again, the partnerships have been really critical to that work. The connections between my staff that speak multiple languages has been very critical, so that we're supporting people in their home languages. The use of our language line access for the languages we don't speak have been really critical during this time. Just lots of challenges, along with the unrest in our communities too, that safety has been like at the forefront, from COVID to the unrest in the community. For my own staff, having gunshots happening in their neighborhood and needing to come the next day and support people that are scared or angry at them. So there's been a lot of challenges, but it's we keep at it because it's important and it's great work, and we want to be here for our families and help them understand what's critical for them, provide that resource through partnerships. But it's an ongoing battle, and we're going to keep trying and keep plugging away. We're definitely not perfect, but we're heading the right direction, and we're the intent is there for sure.
Thank you. Thanks, Mary. I hear a thread of humility, as well as like we're all being stretched in really new ways and different ways. And in my mind, that clicks for opportunity to do things differently. And that's in general responses to all of the richness and wisdom in the room. And the umbrella term I'm hearing is like clearly trust, partnerships, relationships, language, like cultural focused, targeted methods to support our communities. And then just because I'm a little bit, I like to get myself in trouble sometimes. Underneath all of that, I think there's this new wave of funding that has come through from the Fed, from the state, and then local jurisdictions. And so I don't want to put anybody on the spot, but this crisis did create an opportunity for us to make very significant investments, and in different ways than I think we've done it before. And so I'm wondering if anybody has some thoughts or comments around what did that look like in terms of dollars? What did that look like in terms of things that we got to do differently? And I don't want to get too political, but there's lots of opportunities. So I see Commissioner Matas Castillo. Go ahead, go for it.
I'm going to give you some cover, Maria, and I'll do both side. The opportunity for us to receive, whether it was CARES funding or the ARP funds that came in the second round from the federal government, really gave us an opportunity for a local municipality that struggles year after year on a really tight budget to kind of take a deep breath and invest in areas that we've been wanting to invest in for a really long time. And it provided an opportunity to do that. And because some of the normal restrictions were relieved, we could invest in community that has needed these investments. And we had the opportunity to do that. And to me, that's really been the beauty in all of this, is that we could lift up our immigrant communities. We didn't attach status, the legal status, to a person on whether they got care or not. And we could kind of push that all aside to do the right thing for our community, which we've wanted to do for a long time. What it also did is it launched us into the future. So now, good benefit to the community. We can't go backwards. Like, we've made these investments, we're committed to these investments, and I know as the chair of the Ramsey County Board and my colleagues, we're all in, and we're not going backwards because we were able to get there. And so those funds that came in were incredibly valuable for this community building, for the opportunity for community, and so that we can all really do some creative thinking outside the box from the old status quo. So it has been tremendous, and we want to keep advocating at the federal level and at the state level that we get more funds that are not so, with so many strings tied to them that doesn't allow us to do the things we actually need to do.
Thank you so much. Mark.
Yeah, absolutely. I think, there's clearly no quick fix for this. Things like the incentives, obviously very useful as a tool in the short term, mostly just to mitigate hospitalizations and death and get people in the door. But clearly there's generational longer term needs that are going to have to be addressed. And I think if anything, given the massive impact this has had on the country, reinvestment in public health under some administrations, CDC, NIH, FDA, all three of those agencies, which are integral to getting these vaccines made and approved and distributed, all three of them combined have a lower budget than we spend in 1 year in Afghanistan, which, that's a couple years old now, but, if the goal is to mitigate death and illness and societal disruption, clearly public health is where we need to start putting our money. And that happens at every single level. I'm thinking about things like scholarships, getting more members of each of these communities, which have borne a disproportionate amount of illness and injury and death, train them up to be nurses, get people out in the community and flood the zone with people who are knowledgeable, who can counter these rumors that we're hearing, this misinformation stuff about, I can't get the vaccine because I have the wrong blood type. There's a microchip in it. It's going to give me cancer. I'm going to turn into an I Am Legend zombie in 3 years. All this stuff.
Mark.
There's only so many, we can't do that at scale, talking with people without a lot more ambassadors, as Kelly mentioned, and everyone's kind of touched on, is you need to have that trust. That is the currency that we depend on. Without those partnerships, without having Mary and without having Oswaldo there, we would trying to do it on our own, it just wouldn't work. And so that's where I see some of this, some of the needs going down the road, and there'll be many after action reviews and reviews of, what went well, what didn't go well. But, clearly this has done a huge amount of damage, and a lot of that is preventable. So, we have a role to play at the local level, at the state level, and of course at the federal level. But, I think getting just more and more ambassadors in the community, particularly recent immigrants, it's just essential. And I don't think, another interesting thing that we saw in, when we do MIC checks are basically, we're just looking somebody up in the database that the state maintains of vaccinations. We're looking for, are they age eligible for the COVID vaccine? What was their interval? When was the last time they had a shot? Those kinds of things. But on the other panel in that, when we're looking for COVID vaccines, there's a huge amount of people who are missing just routine immunizations. How do we change that? How do we get vaccination to be just a very normal part of healthcare? And if you don't have a regular doctor, you don't have a trusted place that you're going to go. One of the most infuriating things I hear, the CDC has radio ads where they're like, if you have questions about COVID, ask your doctor. Well, the people that we're working with and the people that we're trying to help they may not have that, and these assumptions that everyone is just able to walk over to their doctor's office and, with or without insurance is nonsense. So that's where we need to start, at the ground level. And instead of having the government say, do this, here's $50 for your trouble, this is not a long-term solution. That's not sustainable whatsoever.
Thank you. One of the things that came up, again, the richness is solid. One of the things that came up is, in today's political and global climate of conflict, are their experiences, there was a question around recent folks who have been displaced and how that's impacted our response. We're a racially and ethnically diverse community in terms of what's happening with us on the ground, and then adding more to us needing to provide supports. There was a question around, have folks have any experiences, witnessed anything about health and response situations within refugee populations that have recently arrived, and is there some lens here? Go ahead, Mark. Are there others who have a response to that? I know from a public health perspective, we've done some research and found that the longer folks stay in the US and the more disconnection that they have from their home country, whether it's tradition, culture, food, sometimes their health worsens versus newly arrived folks. I'm wondering if there's a shift in that. And I don't know if folks have any thoughts of that, but that came up in the chat.
I think for the new refugees, there is some challenges they normally experience when they arrive. I wanted to answer that question from the chat. So in our VAX events and testing sites that we normally support, we normally see new refugees who came to this country in getting the access of getting testing sites and also vaccine events. We have seen a lot of Afghan refugees who recently arrived who attended in our VAX events because it's more closer to the new immigrants. As I said, Ayana works as a hub to serve the Somali immigrant and East immigrants in Minnesota. And we have seen a lot of refugees. And when they came, probably, like we asked them the questions, how you ended up here, what kind of challenges you are having in terms of public health and all that kinds. And, one thing it's really good because I know the resettlement program is from the county level or the state level probably provide some sort of health assistance to the new refugees who are coming to this country because there is an intended agencies who normally supported those new refugees who are coming to the country because they have health insurance. They do have, some case managers coming from local agencies at the county level or a city level or the state level, probably who are supporting with them. But the most important thing is many refugees are not getting enough orientation in adapting a new life. When you are coming a new country, there is a lot of new challenges. The language is one of them. The systems, in particular, public health system is another. So there's a lot of challenges that the new refugees are experiencing. And I totally agree with Mark. We need a huge investment. The vaccine incentive it will be a short-term solution for those people who are turning up to the VAX events to bring those families, but it would not be a long-term solution for those families who are coming to this country out of despair. Many families and many communities are coming from countries like Afghanistan, and most of the immigrant population who are coming to the United States, they didn't came here for nothing. They just out of war, out of despair. They just came here to run after American dream. And, during a pandemic when COVID-19 is, killing thousands of people across the globe, many people are having a lot of challenges. So I think one of the good things that I would like to mention is thanks to the Minnesota Department of Health initiative of COVID-19 community coordinator, because I know they are working diverse populations in the state and they do have CCC lead in every diverse population. For example, Latinos, they have a CCC lead. They have new African immigrant CCC lead. They do have refugees and new immigrants CCC lead. I know there are some local refugee and new immigrant contractors with MDH that hosts a vaccine events, that hosts food shelves, that probably work to connect other resources to those new arrived families to the state of Minnesota.
Thank you. Thank you so much. We're coming up on time, so I see some hands and I'm going to get to the hands likely in response to the most recent question. The other thing that y'all can ponder as we kind of do this last round and we'll be coming to a close is think of our relationships we want to maintain. What are the instruments and what are the tools that we need to preserve the relationship for us to all stay in this connection, for this coordinated and focused effort to level up folks to be all having the fair outcomes around health and racial equity. So you could think about what tools or what would be helpful for that. And I'm going to pass it to Ingrid, likely responding to some of the newer arrival refugees and immigrant populations. Is that correct?
Yeah, thank you. And I'll be really brief, but just wanted to kind of piggyback on what Abdiqafar was saying and share that we've been involved in providing vaccinations in partnership with organizations like MDH and the Mobile Health Initiative out of U of M for the many newly arrived Afghan families. And I think what's striking is just, it's such a blatant example or of how overly complicated our system is, and when you're meeting somebody who's, really just arrived and is carrying a lot of complexity and trauma and and you're trying to explain kind of how our system works, and you realize you hear yourself and you're just like, wow, we have got to make things easier and more accessible. And we get a lot of questions when we're out at these community hubs, at the mosques, at the malls, at the community centers, from community members who ask things that are, on the surface, not health related, but are like, how do I apply for asylum? I'm losing my apartment. How do I, these questions are coming to our nurses. And because of, our partnerships and the relationship with the CCCs, we often, have a few more ideas or resources or ability, but to connect people. But how can we continue this model to make these centers more of these hubs where folks are represented, culturally and linguistically, and have an opportunity to get some more of these broader needs addressed? And how do we make those access into those services a lot easier for folks? I think we put up a lot of unnecessary barriers, and I just wanted to.
Thanks, Ingrid. I hear you saying if we can decrease the red tape, we should try to do that. Okay, Oswaldo, I think you had a response as well.
Yes, it's about the same question. And I just would like to add that in the program that we have, the health window program in the consulate, we work with the first contact with the Mexican refugee or Mexican migrant community coming into United States or coming into Minnesota. So part of the principal roles that we that we do is be the first contact and navigate between the migrants and with the health system in Minnesota. So in order to try to understand how works the system and try to looking for reference resources for direct to the community, to try to open the door for the access to health services and the health rights in the state. And it's a big challenge. And this example, the collaboration in different scenarios with local public health, hospitals, community clinics, leader organizations, public schools, even, because it's a great resource. I, in my mind, is very, very important to continue growing up this collaboration with other different organizations. We increase a lot of the number of the alliances that we have with other organizations, and it's very, very important to continuing growing up this collaboration in order to extend this access to the health services in the different communities. Thank you.
Thank you. Thank you. Any other closing comments or thoughts? As we get closer to time, I want to make sure everybody felt like they had an opportunity to share.
Yeah, Mary, this is Abdi.
Thank you. Mm-hmm.
Yeah, there's a question on the chat. Alerta Shanda asked, like, what kind of the most efficient channels of communication that we use during the comment mobilization. So thanks for that question. I think one of the very difficult was the outreach and community engagement when you are hosting a vaccine event or supporting a community testing site. The channels that we were using, as I said, Ayana has member centers from the Islamic centers across the nation, in particular Minnesota, we have over 15. We were sending staff and doctors on Friday congregations. You know, some immigrant communities are more religious, like Somali population. Mosques are probably the epicenter of the population. They normally go there 5 times a day to pray, like 100, 200 people normally attend this on normal prayers. On Friday congregations, a lot of members attend those congregation prayers. So we send some staff from Somali Doctors Association and our staff to make a weekly briefing and announce those that we are hosting a vaccine event on the specific date. Because the mosques and other partners play a vital, a crucial role in attracting more people. The other channel that we used was we created actually and disseminated a program called Hogwaran. Hogwaran in Somali, it is an information sharing. That Hogwaran, it goes live on local Somali TVs in Minnesota and attracts like 70,000, 100,000 viewers, and many people probably come to that kind of our vaccine and testing events through that. We also use the other communication channels like social media platforms, and also we send mass emails and mass texts to the community in order to attract many people to attend those vaccine and testing sites. Back to Mary.
So I am going to leave it here and just see if anybody has any other words. I'm thankful that I was able to be in this space and help convene this group. I think the more we peel back the layers of challenges, the more we can maybe reveal opportunities. And I hope that we can continue to be in connection. Sometimes that looks like a contract. Sometimes that looks like a memorandum of agreement. Sometimes that looks like a community commitment. Sometimes that looks like building alliance together. But I think the multi-sector approach, the leveraging the different resources that become available, and us speaking truth to power about the depths of these challenges and how COVID and other public health crises are impacting our communities is really important. So thank you so much. I see some closing chats in. I see Susie popping in. So I'm going to leave it there. Susie, if I'd missed anything, let me know. But I'm so
think you've
happy.
missed nothing. And I'm so glad that you took moments of pause, but also helped to guide and contribute to the conversation along the way. I think I'll speak for everyone that was, I think, a really wonderful job facilitating. So thank you so much. And I'm really grateful to all of our panelists who, despite I think we probably easily could have made this a 4-hour webinar. And I hope we can continue this conversation in additional spaces. But I think one of the reasons that we really wanted to bring you all together today is that I think what's happening in St. Paul and the Twin Cities we're one of the things I noticed mentioned multiple times here today is, especially I think it was Ingrid saying, the work that you're doing and the organization that you represented, that health equity was a piece of that initial process 16 years ago, right? This is not sort of jumping on the bandwagon with health equity, but that has really informed so much of what's been happening here, whether it's with the St. Paul Public Schools or Ramsey County, et cetera. So I'm really thankful to everyone today. And I especially want to thank Mark for collaborating with us and extending your ongoing partnerships to bring all of these folks together. And thank you to everybody who joined us to view this conversation, and hope that there are some moments of inspiration and hope here for us all. And I will just assure everyone who joined us that we will be sharing the recording of this event after for you all to share or connect with as we move forward. So it is Friday, and I will close us out by saying thank you so much again, and we will be in touch. Thank you, everybody.